One of the more common findings that I see on a foot x-ray is a heel spur. Many people think that the spur is the cause of their heel pain. In most cases, that's not so. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. Most people live long, happy, pain-free lives with a heel spur. In today's video, I'm going to bust the myths associated with a heel spur. Before I do, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find the information they need. I also wrote a book all about bone spurs in the feet. You can get it for free at www.bonespurbook.com. Many people who suffer with heel pain assume that they have a heel spur. Some do, and some don't. But even if they have a heel spur, it's not necessarily the cause of the pain. The confusion is understandable. Heel pain can be named a few different ways. Commonly, heel pain is due to plantar fasciitis. It's also referred to as heel spur syndrome. That implies that the heel spur is responsible for the heel pain. A heel spur is a bone spur attached to the calcaneus, the heel bone. It is also an attachment to the plantar fascia ligament. When you walk, the ligament pulls on the heel bone. When there's excessive tension on the heel bone, it lays down new bone in the direction of the tension and forms a heel spur. Here's the thing. The heel generally has a thick fat pad. So even if a heel spur forms, it's usually well cushioned. Heel pain is commonly due to the inflammation of the plantar fascia ligament where it attaches to the heel bone, or in this case, the heel spur. This makes it seem like the spur is causing the pain. If that were the case, then the only choice for the pain to resolve would be to remove the heel spur. In truth, surgery is only necessary about 5% of the time. Plantar fasciitis is usually well controlled with conservative measures. These include anti-inflammatory medication, cortisone injections, stretching, icing, and custom orthotics. There is a time when a heel spur can directly cause pain. It happens when the fat pad in the heel wears away. In this case, the pressure from the heel spur is directly causing the pain, since there's no fat padding to cushion it. When this happens, my first pass at treatment is very conservative. I recommend a thick gel pad to be placed in the shoes under the heel. Think of gel as artificial fat. This is often sufficient to solve the pain. Another treatment that's been effective is the injection of processed adipose tissue, essentially injecting fat tissue in the heel. I use a product called Leniva to accomplish this. This procedure is done in the office. After I numb the site where I'm going to inject the fat tissue, I introduce a needle to spread it uniformly just beneath the skin. The results have been astounding. Of course, there are times where the only way to relieve the pain is to surgically remove the heel spur. This procedure is done in an outpatient surgery center. I make an incision on the side of the heel, I detach the plantar fascia ligament and remove the heel spur. This removes the pressure from the heel spur and eliminates the pain. In next week's video, I'll discuss a bone on the back of the heel known as a Haglund's deformity. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. I also wrote a book all about bone spurs of the feet. You can get it for free at www.bonespurbook.com. The link is in the description. If you've been feeling heel pain and are concerned that you've developed a heel spur, don't wait. Contact us for an immediate appointment. That link is also in the description. Thanks so much for watching, and have a great day.